Pterygopalatine fossa, this right here forms the pterygopalatine fossa, and this is a very important structure clinically and also in the exam point of view. So we have to make it very easy to learn also. So talking about that, let's begin. We will be making just like that, but there will be an inferior wall for the pterygopalatine fossa also. We will be making just like infratemporal fossa, but there will be inferior wall also. So you can like look at it right now. This makes the lateral wall just like the previous one, and that is made by the pterygomaxillary fissure, and this is made like the medial wall, and the medial wall is formed by the perpendicular plate of palatine bone. And then this is the anterior wall made by posterior wall of maxillary sinus, and this will be the posterior wall made by the pterygoid process of sphenoid bone. Alright, so that is how the four walls have formed. Now talking about the superior and inferior wall, there will be, this is the superior wall, and this wall will be formed by the inferior orbital fissure of the eye, alright, because obviously that is very logical. And then this is the inferior wall, and it is formed by the palatine bone and palatine canals. And I have put a dotted line in there because some of the textbooks have written that there will be an infero-medial wall. Alright, so inferior wall and medial wall have been fused together to form a single wall, but that will be very hard to depict in a picture, and that is why I divided it into inferior and medial wall to form different structures and a very convenient picture. Alright, so you can draw it like this in your exams also, don't worry about that. So that is how we completed our walls. Alright, so now talking about the contents, there will be a lot of fissures and fossas inside these walls. Alright, there will be connections between different organs in these walls, and talking about that, there will be a fissure in the lateral wall, and this lateral wall fissure will be called pterygomaxillary fissure, and there will be structures passing through this wall. Alright, so the first structures passing through this wall is maxillary artery, posterior superior alveolar nerve, artery, and vein. So four structures have passed already from these structures. Alright, so there will be a fissure in the medial wall also. Talking about that fissure is called sphenopalatine foramen, and there will be different structures passing through that, obviously by the name sphenopalatine. So sphenopalatine artery and vein will be passing from that, and nasal branches of the maxillary nerve will also be passing from that. Alright, so talking about medial wall, again there will be another fissure right here. That fissure named C obviously is a pterygovaginal canal, and in that canal there will be different structures passing again. The first one is like it like brings a connection to the nasopharynx. Alright, so that is the crucial point of this. And talking about fissures and canal in the posterior wall, there will be a Bedian canal, and obviously by the name there will be Bedian artery, vein, and nerve passing through that, and there will be another canal or fissure in that posterior wall again, and that is made as foramen rotundum. You might have heard about this a lot. And then this foramen rotundum, there will be passes of maxillary division of cranial number 5. So if you haven't studied cranial nerve 5, we have a video on that. You can look at that in our channel obviously. And there will be another canal in inferior wall also, and that is called palatine canal. Alright, so that from that structures there will be the passes of palatine artery, veins, and nerves, like that there is a typo in there. There will be nerves in there, and descending palatine artery again. So there will be different canals in the superior wall. Alright, so there will be superior orbital fissure first, and passes are supraorbital artery, vein, and nerve. And there will be inferior orbital fissure again, and the passes will be infraorbital artery, vein, and nerve, and zygomatic branch of maxillary nerve. There are a lot of branches of maxillary nerve. Alright, so that is why there are a lot of structures passing through a lot of canals. So you might get confused, but you can remember like there will be one like In lateral and inferior wall, there will be one fissure, and in medial, posterior, and superior wall, there will be two fissures, and there will be structures passing through that. All right, so that is how we come the pterygopalatine fossa.